Improving lung cancer screening in UHTMC resident primary care clinics. We chose this to be our QI project because lung cancer is the leading cause of cancer death in the U.S. There is an estimated 236,740 Americans that will be diagnosed with lung cancer this year, and over half of those lives will be lost. Lung cancer screening is as easy as an annual low-dose CT, which reduces mortality in high-risk individuals by up to 20%, and yet of approximately 8 million eligible Americans, only 5.7% are actually screened. Recent USPSTF recommendations changed the age of screening for appropriate patients to include all persons from 50 to 80 years of age with a 20-pack year history that is either currently smoking or has stopped in the last 15 years, as opposed to the previous guidelines of age 55 to 74 years old with more than 30-pack years of smoking history. The aim of our project is to increase awareness about the new guideline changes among internal medicine residents and thus increase orders of low-dose CT annual screening for eligible patients by at least 10% over our intervention period. Our project design included an interventional quality improvement to be conducted in the primary care resident clinics at UHTMC from the period of October 21 and November 21, where we were to do separate chart review of the clinic documents to look for appropriate documentation of the smoking history and inclusion criteria, as previously mentioned, that correlate with the USPSTF guidelines, whether lung cancer screening was discussed, and whether or not the documentation of low-dose chest CT was ordered. Then apply the intervention as previously described in December 2021 to January 2022 and review our intervention and see if the outcomes had improved lung cancer screening compliance. Our target population included new patients establishing care in the primary care resident clinic, ages 50 to 80 years old. Furthermore, our intervention will consist of two elements. That will include resident education on the new USPSTF guidelines for lung cancer screening, in addition to a pop-up reminder on the EMR for lung cancer screening. Due to unforeseen circumstances,